as we work to get everybody up and along, in 5 minutes we're going to head over to Harrisburg. 5 minutes we're going to and pick up the feed from the governor as he starts to talk about a growing situation now that has seemed to worsen, and that is COVID-19. We've gotten some updates recently, and now we have to further look at this, and I'm just kind of hustling along to check out his stream, and let's go to the governor. We're going to go back to that. I'm carefully monitoring as to when he'll be on, and a great deal of concern about what's going to be said there. And there, we got that taken care of. Is sometimes it takes a while for their feeds to come up. Currently in Newcastle, sunny skies and 48 degrees. Looks gorgeous out there, folks. And we'll be checking out the governor momentarily as he brings us an update. I apologize for the delay in the broadcast, as the delay coming out of Harrisburg, and not anything that we can attribute it to, as this just happening. Now, we will continue to check on this, and we just got a starting soon from the governor that this will be airing soon. We're going to take another look. Stay with us as there you go. And we will be with that very shortly. I will break in as soon as I see that. 48 degrees in Newcastle, and we've got quite a bit to talk about this afternoon, as Newswatch, bringing you the news and information you need. Governor's news conference due to start here any second, and we will get you that as the governor addresses COVID-19, and this is a press conference that's being held, and it will be on momentarily. Thanks, Marietta Augustine Marietta Simon, Augustine Simon, for your kind comments as we await the governor's news conference. Now I'm going to check back on it, and he hasn't started yet. So here we go to the governor live.
Good afternoon. Good afternoon. And thank you for joining us today for the latest update on the 2019 novel coronavirus or COVID-19. As of 12 a.m. this morning, we have 1,597 new cases of COVID-19. This brings our statewide total to 10,017 Pennsylvanians who have tested positive now in 64 counties in Pennsylvania. Approximately 1,004 have been hospitalized since our first case was announced on March 6th, and that continues to be approximately 10% of patients. 276 of those hospitalized have required intensive care, and 170 of those hospitalized have required the use of a ventilator or breathing machine. Approximately 489 of the total cases are in healthcare workers. And approximately 14% of our 695 licensed nursing facilities have at least one case of COVID-19. Tragically, we have now had 136 deaths among those who have tested positive for COVID-19. And to date, all of our deaths have been in adult patients. Prior to the COVID-19 pandemic, it was actually the opioid crisis, which was the biggest public health crisis that we were seeing in Pennsylvania and throughout the nation. And while our efforts are focused now on this pandemic of COVID-19, the opioid epidemic and the substance abuse epidemic have not gone away. It is critical that Pennsylvanians know that even in these challenging times, help is available. Drug and alcohol treatment providers are open and available during this very trying time and continue to accept patients suffering from substance use disorder. If someone in your life has an opioid use disorder, please keep naloxone at hand, the life-saving medicine naloxone. If you need naloxone, I signed actually a standing order for the public to obtain this life-saving medication from your local pharmacy based upon my prescription as the state health official. For Pennsylvanians in recovery, we know that this can be an especially difficult time for you. Please stay in touch with your peers and your treatment providers and continue to put your recovery first. Many support meetings, such as AA or NA, are continuing to meet virtually. And if your meeting can only get together in person, please make sure that you are practicing social distancing. And now, please make sure that you're wearing a mask. Treatment for substance use disorder is considered a life-sustaining activity, an essential activity that you need to continue to receive. The Department of Drug and Alcohol Programs has a list of resources for individuals and family members on their website at ddap.pa.gov. Again, ddap.pa.gov. And if you or a loved one are in need of substance use disorder treatment or resources, please call Pennsylvania's Get Help Now hotline at 1-800-662-8787. HELP. Again, 1-800-662-HELP. This hotline is staffed by trained professionals who will stay on the phone with you or your loved one until help can be found and you are connected to treatment providers. Even during these unprecedented times, let us never forget that treatment works and recovery is possible. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or as we all know now, the time it takes to sing happy birthday twice. And use hand sanitizer if soap and water are not available. Please cover your coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. The mask that we have recommended should help that. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the dangerous virus, COVID-19. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from Penn Live. Will the department consider releasing the case and death information by hospital?
Not at this time. We are releasing the case counts and the death counts by county.
Thank you. We have a few questions from WNEP TV. Pennsylvania has now seen more than 100 people die from COVID-19. A viewer asks what the breakdown is between men and women. Is the virus more deadly for men or for women?
I don't have that specific breakdown at my fingertips. I know that in general, men are slightly more impacted by COVID-19 than women.
And as a follow-up to that, COVID-19 can lead to death in people who already have underlying medical issues. Is COVID-19 of particularly high risk for people who have diabetes? If so, why?
Yes. So diabetes is one of the conditions that would predispose someone to getting COVID-19, one of the chronic medical conditions that we have been discussing, and potentially to have a more serious case of COVID-19. Besides it being a chronic medical condition, it's not exactly known why diabetes would impact a person to make them more susceptible, but over time, I'm sure we will learn that information.
We have a few questions about social distancing and masks. First from WNEP TV. Now that the guidance is for everyone in PA to wear masks when out in public, viewers want to know what is the best way to clean them after wearing them. Will putting a mask in the microwave kill germs?
Well, we don't recommend putting the masks in microwaves. Microwaves can be challenging for cotton masks, and some of the masks have like a metal nose tip, and that would be very dangerous in a microwave. Really, we recommend that you wash the masks with soap and water.
Very good. This is from KYW News Radio. How well are Pennsylvanians following social distancing guidelines according to the newest data that you have? Do you foresee the guidelines tightening? As more people become infected, is it still safe to go outside for exercise?
So I don't think we have recent data from the time that the governor issued the statewide stay-at-home order, but we'll be looking for that. Overall, the governor and I feel that Pennsylvanians will do the right thing, and the right thing is to practice social distancing, and the right thing is for people to stay home unless an activity is life-sustaining, such as getting food and getting medicine. It is okay to go outside and exercise if you're doing that in a solitary way. So if you're going out for a walk by yourself, then that is fine, or a run or a bike ride. If you are doing that with a gathering of people, then that would not be correct, because then you're potentially going to expose each other to the dangerous virus COVID-19. In terms of other actions, there are no other actions planned at this time. We have made a statewide social distancing order. The schools are closed. Non-life-sustaining essential businesses are closed. And now we have the new mask order if someone is going outside. And so we're going to depend upon Pennsylvanians to do the right thing for themselves, for their family, for their community, and for our Commonwealth.
We have another question on masks from the Altoona Mirror. Are masks for the public primarily meant to keep us from shedding virus material onto surfaces, as in grocery stores where others' hands could pick it up?
Well, yes. So the masks are designed for people who might not have significant symptoms but might be shedding virus, to avoid shedding virus to surfaces if they may cough or sneeze on them, or in terms of aerosolization of the droplets if someone coughs and sneezes. So again, my mask protects you. Your mask protects me.
We have a question from Scranton Sentinel. There are concerns about whether or not those infected with COVID-19 are adhering to self-quarantine orders. Could you explain what the state and municipal health departments are doing to ensure that those who have tested positive are remaining isolated at home? Or are hospitals not reporting who has been released to their homes that have tested positive?
So we are not getting reports from the hospital about who they release, but there are criteria for how long those people need to be isolated. And every indication is that people are following those orders. So to repeat, if you have tested positive for COVID-19, you are in isolation. If you are not having significant symptoms, then you might be isolated at home. If you are very ill and require medical attention, you would be isolated in a hospital. Contacts of those who are positive would then be quarantined. There are statistics from the experience of health departments from the Ebola issue that was confronted in 2014, and well over 95% of people do follow those isolation and quarantine orders. And so again, we are relying upon Pennsylvanians to do the right thing and to protect themselves, their family, and their community.
This is from PBS 39. We're seeing stress on the healthcare system in the Philadelphia, Lehigh Valley, Hazleton, and Harrisburg areas. Is the health department tracking the state's ICUs, such as how much of them are in use right now and what capacity is left? How many COVID-19 patients in Pennsylvania are on ventilators at this time?
So we are tracking that data. I actually gave you some of that data at the beginning of the press conference. We're tracking it very carefully, and we're tracking it both over time and day by day. So that is information that we're tracking throughout the state, that we're tracking on a county and a community level. And again, I am in contact with many of the county municipal health department directors. I spoke with Dr. Farley from Philadelphia and Dr. Bogan from Allegheny County today, and we're making sure that we know the situation in each community.
This is from Pittsburgh Business Times. Dr. Levine, you spoke yesterday of having a call today with the University of Pittsburgh analytics team. Can you tell us how that meeting went and what you learned from it?
Sure. So we had a great call with Dr. Roberts from the University of Pittsburgh School of Public Health, with many of our staff, our epidemiologists and our public health preparedness staff, as well as myself, Director Padfield from PEMA, the governor's office, and discussed the methods that they are using with their excellent prediction model, and then also some of the assumptions and variables, the parameters that they put into that. And we'll be looking forward to more data by the beginning of next week.
We have a question from CBS 21 about supplies. The governor of New York says the state is getting ventilators from Oregon. Is PA thinking of doing something similar? And if so, is Pennsylvania bidding against other states for PPE, and can you describe what that process is looking like?
Well, the state is doing everything we can to make sure that we are fully supplied with personal protective equipment, such as the N95 masks, but other things such as gowns and gloves, as well as ventilators to supply our hospitals with the resources that they need to take care of COVID-19 patients. So we have received resources from the federal government and the national stockpile, and then we have pushed those out to the hospitals and health systems, as well as PPE to nursing homes and other long-term care living facilities. We have stores of ventilators, and we have purchased ventilators that should be arriving in April to resource our hospitals when they need it. I guess in some ways if we're purchasing on the open market ventilators and things, I don't know if we're in direct competition with other states, but I guess they might be looking to purchase them as well. We have not reached out to other states for their supplies at this time, but I guess if necessary, we might do that. I want to emphasize that right now we have adequate capacity in our system. We have enough beds. We have enough ICU beds. We have enough ventilators. We have enough personal protective equipment for our hospitals. And we are continually pushing out more of that equipment to hospitals as they need it and then getting in supplies. But we want to anticipate and prepare for is the surge, that rise of new cases that could occur over the next number of weeks or months, and to make sure we have adequate resources for that time. And so that's what we're preparing for. But that brings up one of the most important points. The key is to limit that surge as much as possible. And the most important way to do that is through the social distancing initiatives that the governor has put in place. That includes the school closure. That includes the closure of non-essential life-sustaining businesses, and now the stay-at-home order for the entire state. And if, as the governor has said, if Pennsylvanians do the right thing and stay at home, then that surge will be manageable, and we'll be able to, our health systems will be able to deal with that. If we do not practice social distancing, then the surge could potentially be overwhelming to any health system. So in a lot of ways, it's up to you.
In talking about the surge, we have several questions about that and the peak of cases. First, from the Bucks County Courier-Time. Today's total is an approximately 18% increase over yesterday's reported increase in new cases. The percentage change day over day since March 31st has been between 20% and 18%. Are we seeing a trend of the virus slowing down?
Unfortunately, there is no evidence that the virus is slowing down. All the models that we have show continued growth of new cases in Pennsylvania, particularly in the southeast and particularly in the northeast, but other areas too. The day-by-day changes are really dependent on a number of different factors, and a lot of that depends upon the laboratories that are reporting into the system, into our data system that we collect in a day. So very small variations don't mean much. It's going to be trends over time, and when we look at 3-day averages and 7-day averages over time, it's going up. And so we need to be prepared for that surge over time, and then we need to mitigate and prevent the surge from becoming overwhelming by practicing social distancing, and please stay home.
KYW News Radio would like to know, when do you expect the peak of the pandemic to occur in Pennsylvania and Philadelphia?
So I can't tell you exactly when that's going to be. As Dr. Fauci, the director of infectious diseases at the NIH, has said, the virus determines the timetable. We don't determine the timetable or the timeline. Again, we've been looking at various models. I'll be looking forward to the new University of Pittsburgh School of Public Health model next week. There's a University of Washington model that indicates it's in the middle of April. But we will see. But we're going to be tracking it every day. We'll be looking at our modeling, and we're going to work to be prepared.
WJAC TV would like to know if there are any further measures the state is considering if it becomes apparent the previous measures aren't working as well as you would have hoped. And are you worried people will get restless and ignore the stay-at-home order, especially considering the social distancing scoreboard now gives PA a C grade?
So that C grade on that scoreboard for social distancing was before the governor put in the entire state stay-at-home order. So we'll see what that scoreboard says. But more important than a scoreboard is what everybody does now. And again, the governor and I are calling upon everybody to do the right thing and to please stay home to protect the Commonwealth.
KYW News Radio has another question. What are other pandemic measures you would like the federal government to take to help ease the burden on Pennsylvania?
Well, I think it will be important for the federal government to continue to push out through the federal stockpile the personal protective equipment and ventilators that states will need. And so we work with FEMA, we work with Health and Human Services, we work with the CDC and the FDA to get the equipment that we need, to get the reagents and the testing materials that we need to continue the laboratory testing, and we will look forward to that continued cooperation.
Another question about federal government response from Pennsylvania Capital Star. The White House seems to have taken the posture that the states are largely on their own. Is that your interpretation of it? And how frustrating is that, given the magnitude of the challenge that Pennsylvania and other states are now facing?
Well, I don't really think it's upon me to comment upon the White House response. I know that under the governor's leadership, Pennsylvania is doing absolutely everything we can to help mitigate the spread of COVID-19, to do laboratory testing for COVID-19, and to prepare the healthcare community and make sure it has the resources that we need. And we will look forward to continuing to collaborate with the federal government to do their part to resource the states for the needs that we have.
Thank you, Dr. Levine. That's all the time we have for questions today. Reporters, if your question was not answered, we will follow up from the Department of Health or Governor's Press Office, and we will return with another briefing on Monday. Thank you.
Welcome back to Newswatch, and wow. Now we will put out the figures on our Facebook page and post them also as that press release just coming in, and we will get to that. Here's the percentages, if you would. Now, this in from Rachel Levine. That's who was just on there, and she is Secretary of Health. Some of the numbers have decreased in what they're finding. There are 60,013 patients who have tested negative to date. Of the patients who have tested positive, this is the breakdown of the 10,017. Nearly 1% are age 0 to 4. Nearly 1% are age 5 to 12. And 1% are 13 to 18. So, below the age of 18, you're looking at 3%. The 19 to 24 group, they're saying that that is nearly 8% now. Now, if you recall, that was up at the 9% range not too awfully long ago, as far as what it is. And I do want to take and I will compare these for you, matter of fact. So let me take a second and tell you, and this will give you an idea how it's gone down. It was 9%, 19 to 24. Today's release says nearly 8%. So with the folks under the age of 18, nearly 1%, nearly 1%, 1%. Okay, and I have these as they came up. Nearly 1%, nearly 1%, 1%. And so that part hasn't changed. 19 to 24 has gone down a whole percent. Now, the age group currently, 25 to 49, is 41%. That number, 41%, has appeared to remain constant. The next group, which is 25 to 49, when you look at that group was at 41%. Okay, today's number, okay, reflects that same 41%. And the 50 to 64 group, their number at nearly 29%, and then it said nearly 29%. Today they've changed that. It's still at nearly 29%. 65 and older, they've put at nearly 20%. It was 19. Okay. And then it went up to nearly 20. And those numbers just in, and we will put the breakdown by county out there so that you'll be able to see those as we go on. Now, Newswatch bringing you all the latest updates that are in from the state on COVID-19. Now, what we're going to do is we're going to take this break. I have some more information to give you, but we'll be back right after this.
Nctv45 Newcastle, The Train.
The Gathering Banquet Center, an event center located at 2552 Ben Franklin Highway, is the right place for your event. Many buffet dinner packages to choose from, and it makes any event special and elegant. Call 724-652-1149 and let
The Crane Room is a restaurant. The Crane Room is a bar. The Crane Room is a banquet facility. The restaurant will please you time after time with their diverse menu. Ask about their daily specials. See the menu at craneroom.com. The bar gives you an abundance of choices with 35 beers on tap and always changing. Their banquet services are always to perfection. The Crane Room, located at 3009 Wilmington Road in Neshannock.
Seasons change, and when that summer wind blows in, Seasons Change is ready for you. Seasons change, and when the fall brings that autumn rain and down come the leaves, Seasons Change is ready for you. In the winter, when the wind blows and the snow, Seasons Change is ready for you. And then it's spring, and things will bloom, and Seasons Change is ready for you. It's Seasons Change, beautiful shop right in the Majestic.
134 North Street and 139 Fall Street. Seasons change.
Get to Dad's Bar before the rooster crows. Yes, it's Tony's Lounge. Complete with a great bar, pool, yes, jukebox, and a great seating area that is unbelievable. It'll make you hungry, and a wide selection to choose from, including wings. Yes, specials too. Don't monkey around. Get to Tony's Lounge. Welcome back, and I apologize for clicking a little bit slow there, but sometimes that's how it goes. As we try to get you updated on the COVID-19 situation, and we're going to continue on. I want to kind of take this time to let you know that Nctv45 will be working to get to you a programming day page, a TV guide that will scroll for you and be able to give you updates on our programming as we're now embarking. And it's a little difficult, but we are with, and I don't mind saying it, myself and my son, we are in full day programming mode, and we've hit everything that's come along. The Penn State Master Gardeners, they want you to know that the hotline that's usually there, well, with the courthouse closed, the hotline can't be there. And so that being said, they've adopted some new things for you. Lawrence, mg@psu.edu. If you have a question, and I'm just going to, rather than go through this whole thing again, it was on Newswatch Morning. Lawrence, mg@psu.edu, excuse me. Just give them an email and explain your situation, and they will get back to you. Volunteers needed for Meals on Wheels, and the United Way has got and put together a fund for COVID-19 and folks that don't have health insurance. If the money stays here in Lawrence County, if you're interested in helping them out, here's a number, 724-658-8528, and they'll be able to get you the information you need. Now, as we cruise through Newswatch, okay, it's time to get to sports. I'm going to be back with more from the state. It's important to try and get a little breath after you're going through all this. So hang in there. Let's go to sports. We'll be right back. And remember, I got to click. I'm a little slow. Forgive me.
The Cedars Restaurant in Newcastle